All right, so I'm pretty sure everyone heard that. So right now, we are going to wait another minute. Let's start at 2:04. There might be a few more people coming in. And we are going to start our Nurse2Nurse webinar for the month of June. Again, we're really excited that you're here with us. If you have any questions, you can chat me. And we want to just make sure that you're supported and you're comfortable for our really great webinar that we have lined up for today. So we will get started in about 30 seconds or so.
And Ravi, may I real quick?
Sure.
I host, I respect, so I have to ask. I do want to add in to all the participants, all you awesome nurses out there, that yes, it's being recorded, but one part that's definitely not being recorded, just so you feel safe, is the chat. That is not recorded. Not at all. So if there are chat-in moments, this is a safe haven for anything that you want to share or talk about. So I just wanted to add that in.
Wonderful. That's a really great point, Babs. Thank you very much for that. All right. So I think we're ready to get started. Again, welcome to all our nurses for joining in for the Nurse2Nurse webinar for June. Today's topic is optimism, reframing your way forward, which is really, really awesome because we're constantly moving forward, and it's always great to have a better perspective, and we're going to hear more about that. Our monthly webinars are offered specifically for the nurses, all of you out there that are doing direct care, supporting our communities, supporting our family and friends. For everything that each of you do. We always start off and we end with a big, big thank you. Not just for joining us, of course, we're excited that you're here, but really just for everything that you do. I will be the first to say that I come from a family of nurses. My mom, my sister, my aunts, the best people to have as family members. They always take care of you. You always know that you're in good hands. So nurses have a special place in my heart. So thank you to each and every one of you for everything that you do. So with that, we are going to get started. And I'm going to forward and hand off our presentation to Barbara. She goes by Babs, but I'll let her take over. She will be your speaker for today. She has some really great information. So Babs, I hand you the floor.
Hello, my fellow nurses. Thank you for taking this time for yourself today. This, I hope, is going to give you just that little bit of TLC that, if I may, you deserve. Okay, with that said, quick little introduction here. I am Barbara Brilliantine. I go by Babs, 6th grade. It just stuck, and I kind of dig it. It works for me. I am the supervisor for Nurse2Nurse. And right next to me there on the slide is Michelle Julian. She is she's a licensed social worker. She's also a counselor, and she's the mental health clinician for 3 different units. So she has a big job and she's awesome. Forward, please. And then we're going to meet right here, our director, Cherie Castellano. She is a licensed practical counselor, and she's the director of the entire call center. So there's about 34 different programs. I'm not sure if anyone's ever heard of Cop to Cop, but that was the first one that she was able to create and then go forward. And then next to her is Samantha Davies, and I'm so excited about that. She's our program coordinator, and she just began and she hit the ground running, and wonderful resource for us. All right, next slide, please. And we just want to welcome you. As for myself, just really, really quick, so you know me, I won't take a lot of time because I don't like talking about myself, but I've been a nurse for 25 years. Most of my time was hospital setting, which was working on the maternal fetal unit. I worked at a high risk hospital. So 50% of our deliveries maybe didn't have the best outcome, but to me, that was where I needed to be the most. And as nurses, you know that feeling in your heart, that you want to be there, of course, for the happy times, but for the tough times, that's when we shine. Why? Optimism. And we'll talk about it. We'll talk about it. Nurses are amazing at this. So if you would like to, oh, and we always ask for a resiliency word. Resiliency word can be anything that you feel like you can put a label on what keeps you going, or right now, what keeps going. Mine for today is perseverance. So if anyone would like to either unmute and talk, or again, chat completely anonymous, we would love to hear just where you're from. Perseverance as well, Melinda. Yes. Or if you just want to write your word in. Tammy, nurse, 27 years. Currently inpatient wound care in acute setting. Cat's got my tongue. Resiliency word, faith in each other. It's beautiful. Thank you for sharing that, Tammy. And if anyone else wants to chime in, that's great, but we're going to go forward on the next slide as well, but we would love to hear from you. Just to talk about a little bit of the background of Nurse2Nurse, just so you understand where we're coming from, what we do, what this entire unit is about, the call center. It is a reciprocal peer support. What is that? Reciprocal, we know the definition of that. You give, you think you're giving to us, blah, blah, blah. Cat got the tongue. You think we're giving to you with our time, but I'm telling you this by 100%, we get it right back. And, you know, the universe, higher power, however you want to say it, always make sure that for some reason that day, that call is exactly what we needed as well as you. So it's very reciprocal. All right. We take care of, this is not just Nurse2Nurse, but the whole call center, unique populations. Who are they? They are the caretakers. They are the ones that are high risk populations because we are giving and giving so much. We here like to say we rescue the rescuers, but you rescue us right back. So thank you for that. We do focus on prevention, intervention, and postvention. And what that means is that our resources are lined up with those three things. And we'll go over more resources for you. And for nurses, this is so important. I think for us, we're evidence-based. So Cherie, who I mentioned before, she developed the reciprocal peer support model, and it is not, it's been nationally recognized as wonderful, but also successful. So many other wellness groups or peer supports, they have come to us and say, hey, how does this work that you guys are being so successful? It's because it's evidence-based. She did the research on it. And there's a model we follow. Okay, if you could advance. There's the first responders. You are the rescuers. And you guys know that, but it's kind of, we don't like to think of ourselves as hero or a rescuer. We just think of ourselves as being ourselves, a good-hearted human being, which is so important to us. Next slide. Just a little bit. I'll try and do this quickly. It's an initiative of Rutgers Behavioral Healthcare and New Jersey Nursing Initiative. Important thing here is, although that is who we are under, we are not affiliated with anyone because we are grant funded. So that's, again, to the efforts of our creator. Why that's so important is because it's completely anonymous and confidential, not affiliated with anybody. The only time that we would intervene is in a crisis situation. What is a crisis? A crisis would be that the person is in need of more professional care at the exact moment. Something is about to happen at that exact moment, and we need to intervene. That's when we intervene. And I just wanted to bring that up for a resource in case you come across that situation at work yourselves or with one of your nursing friends. We are funded by the New Jersey Pandemic Relief Fund, as well as joint effort with the Robert Wood Foundation and New Jersey Hospital Association, and the as I mentioned, the New Jersey Nursing Initiative. Reminder, we're not affiliated with anyone, completely confidential. It's just us with you. All right, forward, please. Here is our flyer. It's a quick overview. I will say to you, just to break this down, that we take care of other people, and this is a moment to take care of yourself with our resources. Put yourself first. So unheard of for nurses, but that's what we're trying to tell you, is you need to fill up your own tank. You know, the whole thing about the airplane, put the oxygen on your face first, even before your child, who you would do anything for, but you have to be there to take care of them. You have to be there to take care of yourself for your patients and loved ones. Self-care is important. And that's what we're trying to do, is tell you it's okay. You have permission to put yourself first, and we're here for you to do just that. Our phone number's on here. You can always get it as well online. And we're open Monday through Friday, 8 a.m. to 8 p.m. Advance, please. All right, let's get to optimism. All right, so there was a COVID study that was done in 2021, and these are the results. 93% of nurses felt stressed. It's a pretty high number. 82 experienced emotional exhaustion. Again, pretty big number. 75% felt overwhelmed. Again, that's most, 3/4. And 30% of the nurses who've recently left the profession, it's because of burnout. Does this sound familiar to anyone? I guarantee you that we all agree with this. And I just want to give a shout out real quick. Another perseverance word from Joanne is faith. Yes, love that, Joanne. If you could advance. All right, so why are we talking about optimism today? UPenn has a resiliency skill set, and it's part of the, I have to look because I always get this confused because the wording, the Positive Psychology Center at UPenn did a gigantic study, long-term study, and they came up with certain character strengths that you can say is where all resiliency comes from. So that's what we've been basing our webinars on thus far. Today, we're talking about optimism. What is optimism? The ability to notice and expect the positive, to focus on what you can control, and to take purposeful action. And I have to say this real quick because this is a learning experience for me too, as I was researching the Positive Psychology Center. I always thought that I always thought that optimism was just meaning that you just are a positive person, and meaning that you're kind of always happy and spreading sunshine and love to everybody. But no, while that might be true, the real definition and meaning behind optimism is that you are somebody, when you're optimistic, even in the most dire moments, you know, I should say no, because it's in your heart, you know that things are going to turn out okay. And with that knowing, with that perspective, it's then that we focus on these things we can control and take purposeful action. Doesn't that sound exactly what a nurse does? I don't know, maybe I'm going to give a number 1 trillion times a day. That's not evidence-based. That's Babs's opinion. But optimism, so important. Advance, please. Challenges for nurses. Tell me if this sounds familiar to you. Demanding workload. And by the way, when I say these challenges, don't get down on it. Just feel like you can relate, because we're all here. Let me for a moment validate why you might have a challenge, okay? Remember, this is your moment. Demanding workload, staffing shortages, workplace violence. We know that's increased since COVID. Risk of exposure to infection, again, has always been there, but then COVID highlighted it, but also increased it. Caring for critically ill patients. And that doesn't have to mean the ICU. That just means people that are in a critical moment in their life, whatever arena that may be, and you're there for them. But it's a challenge because we care so much. Our empathy and sympathy, it hits us hard. Death of patients. That's very specific to our nursing profession. That's not something that another profession experiences as closely and meaningfully as we do. That can take a hit on our optimism. And moral distress. Moral distress, especially during COVID, but in case anyone doesn't know, moral distress and moral injury, they are when how you're caring for someone doesn't line up with your morals, which could mean you want to spend at your patient's bedside, you want to spend a good amount of time with them that you believe that they need, but due to shortages and the demanding workload, you can't be there. It's just physically, humanly impossible. And then we go home and it's this moral distress. We're injured morally for not being able to do that. Takes a hot hit on your optimism. But let's go forward. Challenges for next slide. Sorry, Robbie. Next slide. Oh, Ravi, next slide. Thanks. Okay. How does optimism show up for nurses? First, I want to ask you for your opinion on this, because I wrote out some things that I researched, but I want to hear from you how you think this, hey, everything will work out in the end, perspective which is optimism, how that shows up for nurses. Let us know in the chat. Again, when you share on here, it's safe, but also it validates to your fellow coworkers, everyone else that's online right now with you in this moment. It says, hey, yeah, I experienced that too. Normalizes normalizes things for us. Okay, so how does it show up? Hey, new nurses, right? They come into the profession bright-eyed and eager to learn, but that's awesome. That's optimism. Experienced nurses, mastering the electronic medical records, even though they lack familiarity with technology. That's optimism. Nurses advancing any type of certification, even if it's a quick in-service, all the way to an advanced degree. That is optimism in you. Nurses experience, this is the one that I feel hits home the most. Nurses experiencing a tough shift only to return to it all over again. That's incredible, guys. That's optimism. And being supportive, like I was saying, not just for your patients and their family members, but your fellow coworkers, your loved ones. We have someone that chatted in, experienced nurses gaining new energy by precepting the new nurse. Yes, right? We would love to kind of sit there and say, this is going to be rough. And we do, but we do it in a way that creates optimism in that nurse. Hey, this is reality. However, this is how it's all going to work out for you. Next slide, please. So let us discuss some. Ravi, I think we missed a slide, which I think it's really important. So I just want to go back. Yes, that's the one. All right, because I love this line here. So why is optimism important for human beings? But here we're talking about nurses, and I want you guys to know this so you can develop these your optimism that you already have, and I'll let you know why in a second. Optimistic nurses remain healthier and live longer. This is my favorite line. Optimism is a potent health tonic for nurses. Better than any type of medication or anything you could do. It's potent. What does it do? It improves not just your perception and psychologically and mentally in your heart, how you deal with your world around you, but also your health. Remember, take care of yourself first. Remember Maslow's hierarchy of needs? We're talking physiology first, right? Here's how it helps. Better cardiovascular, and this is all evidence-based. Better cardiovascular health, stronger immune system, lower levels of pain, and lower levels of stress. Wouldn't we all love to have this? By the way, my wording there is because, sorry about that, but it actually increases your strength all around. And before we go to the next slide, I want to talk about, because we're talking about, I keep saying evidence-based. I think that that's really important because it shows that this isn't just something, everyone's just created, oh, be optimistic, just see your way through it. No, this is a skill, a strength that nurses have, that you have, and you need to keep growing it and developing it with these skills that I'm just giving you a few today. Also, this is very interesting. Do you know that research shows genetically optimism is passed on? Isn't that incredible? It's in your DNA to be optimistic, but just because it's there already doesn't mean that, oh, I've got it, I'm good. You have to work on it and grow it, just like any skill. And the same goes for someone who didn't get it genetically. They can get that character strength by developing it, growing it, working on it. Okay, I just needed to add that. I found that so interesting when I researched this. If you could advance on. All right, so I'm going to give you 3 ways today, simple ways, things that you can add into your day very easily that will become a habit for you. What everyone knows, if you don't know, it takes about 6 weeks to create a habit. So these simple things, if you intentionally do them a couple times a day, you will develop the habit. So let's start with language matters. Saying something like, oh God, I have to go to work today. How about I get to go to work? And trust me, we might not be feeling it, but that's cultivating optimism, is by changing the language in your thinking. And as it says here, obligation versus opportunity. It's also tapping into that gratefulness, which also helps with our self-care. 3 times, when you're brushing your teeth in the morning, next time, this is a little extra. Think of that you're going to be brushing your teeth, right? No matter what. And you can do this at night too. It's a habit already. Go ahead. When you're looking in the mirror, looking at yourself, think of 3 things. Think of 1 thing that you are grateful for. It's better to do it in the beginning of the day, just because it sets a tone. It creates that optimistic feel. And you can kind of roll on from there. Going back to language. All of this shifts your perspective. Areas where we can be mindful and intentional. Positive self-talk. What is that? That exactly what it said right there. I have to go to work. I get to go to work. How about also something positive self-talk, instead of saying, man, I've done this a million times. I can't get the hang of it. I can't do this. How about, I've come a long way and I'm going to keep working on it. That's optimism, and it's positive self-talk. Verbal conversations, just in general, watch your words, be more intentional. Try to stay away from the best you can, the can'ts, the I didn't do that. How about missed it this time, get it next time? See, the verbal conversation. By the way, that's something you can say to your coworker. Changes the tone, shifts that perspective for you and the people around you. Emails sounds silly, but that's a form of communication. And I'm going to talk about that a little further in a moment. Even meetings for any of the nurse leaders, that language you use, it really matters. And people are listening, and as soon as they hear something negative, a negative language that you're using, that starts to shift their perspective for the rest of the meeting, how they're going to intake anything that you're saying. And that goes the same with any conversations you're having with anybody, coworkers, family members, children, friends. Just watch your language. And I guarantee you, as you start doing this intentionally and it becomes a habit, you're going to see huge, huge shift. How you feel in your heart, you're going to be even more optimistic than you are now. And you're going to pass that on to all of those other people, which you know we love to help. So this is a way to help yourself and others. And I'm going to ask, chat in, what other areas do you think that we can be mindful and intentional in our language? I'm gonna, as you're thinking about that, we're gonna go to the next slide real quick about emails. Emails can matter. Let me read this to you. An email has an ability many channels don't create. Creating valuable personal touches at scale. A lot of people think, Babs, or maybe you're thinking, it's an email. No, I get it. Most of them are mundane business as usual. But here, let me throw this at you. How about sending a picture out of nowhere to one of your loved ones or one of your coworkers of a picture that at one point they shared with you of their child or their parents or their pet, something that means a lot to them. Just a picture. You don't even have to write a narrative. Just send it away. And you know what? I did this about 3 weeks ago with one of my coworkers. And you know what her response was, which was to me the best response in the world. I wrote it down. It's not even a big deal, but I wrote it down. Best email of my day, Babs. And I knew what that meant. I just passed on optimism to her. I just made her heart feel a little better, which made her day a little better, made her a little better. And that's what nurses love to do. Just any way we can, in the tiniest way, make human beings feel a little better. That's why I wanted to put this on here about the emails, because some people are like, emails, that doesn't make sense. But yeah. And yeah, you can do it via text message too, of course. But there's something about an email, because again, it's usually all business, that it kind of takes the person back and it hits them a little harder. So that's a great thing that just randomly you can do for anyone you love. Or, hey, why not? Might sound silly, but this stuff works. Why not send it to yourself so you can look at it later on? Like send it the day before, so it's the first one you get in the morning. It works. It'll set a tone. It'll set the tone for optimism. Ravi, if you can advance on. And if you can't tell, again, evidence-based, I researched it. This is the word they keep using, but I think you're getting the hint at this point. Optimism is contagious. You know, everyone just saw COVID, how, you know, so contagious, so contagious. Optimism, how you can spread it, makes COVID's contagiousness look like a kitten. And I'm not demeaning it or belittling that, but I'm telling you that it's true. For a human being, very contagious. That tiny little thing, contagious for ourselves and the people around us. Speaking of the people around us, another thing you can do, create a positive environment. This seems like it's out of our control, but remember, optimism is looking at things we can control. So let's take a look. People you surround yourself with. consider their negative cycle, and you can always back away, whatever at work. If you have someone who experiences this negativity, it's okay to back off from them when they're experiencing that. It's contagious and it is going to affect you, and you have to put yourself first. Your patients are depending on that. You have to put yourself first. So if someone that is at work is around you and they're just overflowing with negativity, just excuse yourself, walk away. You don't need to be present for that. Another thing, you can kind of set yourself up. You can kind of set your environment up for positivity, or excuse me, optimism. Post affirmations and positive inspiring quotes. You can post them anywhere. In your mirror when you wake up in the morning, in your phone. I know it says here, set reminders in your phone. Why not, again, send yourself a reminder at 2 p.m. Hey, you're doing awesome because you have an amazing heart and you care. Can you imagine getting that message? You're getting it from yourself. You're creating a positive environment by doing a simple thing like that. You're creating optimism for yourself in that moment, and it's going to be something that sustains you all day. Fill your physical space with things that make you feel good. Like I said about the photos, it's how about when you're at work, putting either a positive affirmation or a photo of whatever makes your heart happy in the back of your scrubs, in the back pocket, or the pocket right up here, and whip that out, take a look at it, put it back. It takes a quarter of a second, but that is going to help with your optimism. It's just going to connect with you in the best way. Yes, Melinda said, picture of the ocean at my desk. Yes. If the picture of the ocean is what makes your heart happy, do that. Some people, it's the woods. Some people, this might sound silly, but some people like the way they decorate their house and it makes them happy. There are no limitations to, there are no no's. Whatever it is that makes you happy, it's the reminder, creating that in your environment. Also, I wrote here, and I was hoping everyone would enjoy this. Code Lavender. Aromatherapy is a wonderful thing. And lavender, everyone knows, is, hey, guess what Babs loves? I wear this and I sprinkle it around the house daily. Not a million times, but just once or twice. And that, I don't even realize it, is contributing to my optimism. I did it. The reason why it's at my desk, I wasn't even planning it. It's because I wanted to make sure that I was giving you guys my most optimistic self. So I went ahead. I know that works for me. I also have a beautiful picture in front of me at my desk. These things, I know they work for me, and I make sure that these things are part of my environment, whether it's if you just need it at the moment or daily. But it's great to have it handy that you created it in case you need it at that moment. Yes. Okay. And then also in the chat, yeah, someone said, Melinda says she has a calm aromatherapy inhaler at her desk. Yeah, try and think of your 5 senses, guys. Another great thing is journaling. Journaling does not have to mean that you're, taking a book out like the picture here and writing everything out. I like to think of it as it's just whatever's in your soul at the moment. So it can be a positive affirmation. How about if you just had a really hard time? I'm not even saying day, just a hard moment. Writing out that pessimistic thinking, getting it out of you, getting that toxicity out of you. By the way, you can do that at work, even if you are in a rush. You know how? We have report sheets. Write out 3 words you're feeling. Boom. You labeled them. It's out of you. And you're going to feel better. I promise. It's out of you at that point. So that's what I mean by journaling here. And once you get into the habit, doesn't mean you have to do it every day, every moment, nothing like that. But when it hits that your optimism isn't at its best, boom, you have you have this skill set. You know what to do to help with that. You're helping yourself. And that's important because you are so important. And I hope you know that. Next slide. All right. This is another thing about creating a positive environment. Post it. All right. So you can, I'm going to read a couple of these just because they are kind of positive affirmations as well. And it's always nice to hear it. So if you just give me a moment with my middle-aged eyes, I'm going to read this to you. How about if it doesn't challenge you, it doesn't change you? We don't like to hear that because challenges make us sad and tense. But then you work on the challenge, and then all of a sudden you change for the better. Your perspective changes and you feel better. So that's a great reminder. Make yourself proud. I'm going to ask you to make yourself proud by taking care of yourself, by implementing self-care. All right, I think that's fair. What else do we have here? Oh, everything you need is inside you. This is true. Remember what I was saying about genetically with the optimism? I would love to see a study for nurses. I'm sure that it's almost 100% that all of us have it. But no matter, it's inside you. All these good things are inside you already. Sometimes we just need a couple of tools and to make it shown to ourselves that it's there, to make it stronger, to make it more effective in us. We're in charge of that, and it's already inside you. Imagine that. You're looking around, I wish I had, and it's already there. It's inside you. You have to tap into it. You have to grow and develop it. That's the hard work, but that's why we're giving you these simple tools, because they're simple. Post-its, just a little note. That is simple. And I just wanted to share, when I was on the maternity unit, morale was down badly. And I had never heard of this, but someone handed me the roster sheet of all the nurses. And for some reason I was like, I'm going to write a post-it about a good quality about every single nurse here. And I'm going to post it on that wall over there. And I did that. It was about 150 of them. Now, mind you, this just happened to be I won't say the Q word, but it was a calmer shift that I was able to do this. But you can do this with other coworkers on an off shift. And by the way, it didn't take a lot of time, kind of flowed out of me. Oh, when the nurses walked in, one by one for the next week, because everyone's shifts are different, they were looking, oh my God, where am I? Where am I? The effect was huge. The optimism rose. By the way, I stayed anonymous on that because I didn't want anyone to know that I did it, because that didn't matter. What mattered was that I wanted to spread the optimism that I felt at the time with everybody else. And then reciprocally, as I saw everyone with their gratefulness and their gratitude for reading that increased mine. Okay, next slide. So post it. One of my favorites, create an opportunity for laughter. Smile relaxes the nervous system. I don't know if you know that. Again, evidence-based. By the way, anytime you want, you can chat in when was this I just loved writing this. When was the last time you laughed until you cried? Share that moment with us. It's a good one. Going back to, so it relaxes the nervous system, generates an energy boost. We could all use that, right? Nurses love their caffeine, their tea, and their coffee. Why not create a little laughter? It does the same thing. Improves communication and trust. This is true. The endorphins start hitting and you just feel better around the person or people that you're with. All of a sudden there's a bond. Everyone knows what I'm talking about. And if you've ever been to a comedy show, you're looking around at strangers going, oh, that was a good one. Oh, you too? That's awesome. That's a bonding. That's a trust that all of a sudden we're communicating. And this act supports the release of stress for you and your coworkers. Oh, yes. I'm going to get to that in the chat real quick. But yeah, if anyone has anything about the laughter, if they have anything they want to share, I'll tell you what I want to share is a video, and which I put on the next slide. This is from, his name is Nurse Blake. He is really big on social media, and he kind of even exploded during COVID because he's so relatable and it's so funny because it's so real. Joanne, I'm going to get to your comment about language in just 1 second. Let's just take a moment to feel some laughter. Ravi, if you can play the video, that'd be awesome.
I'm just waiting to clock in. I think I have like 2 more minutes. Hang on a second. I'll be able to help once I clock in. Oh my God, these wheels do not work. This is crazy. I think I'm gonna have to call down and get the engineers to come fix this. Okay, I'm ready for a report. I've had to get a report from like 4 different nurses. It's like crazy when that happens. Are you almost done? My nose itches. It itches. Hey, you think this coffee's so good? Hey, did anyone know the tube station's down? So I'm gonna run this lab down to the lab. So I'll be back. Can you just watch my patients real quick for me? My password's not working, so I gotta call IT to reset it. Operator, password not working. Oh. Hello, this is Blake. I'm a nurse here and I need to reset my password. Can I hold? Oh, sorry. Hello, this is Blake. The lab was hemolyzed. I have to draw it again. Okay, yep, I'm doing it now. I'm going back down to the lab, so if anyone needs anything, let me know now. Okay, lab. Does anyone have the PCA key? The PCA key? Oh, I need a PCA key. Hello, this is Blake. Oh, I hope it's not hemolyzed again. What do you mean it wasn't enough sample? Hey, have you seen X-ray? I'm waiting on a chest X-ray on one of my patients. No, it was staff. Okay, I'll just call them. I'm on hold. Does anyone have SCD pumps? There's no more in the supply room. I called down, my phone's dead. How long do you think this is for? I'm hungry. Oh, that's not bad. Oh, here, I have this one. Did you guys get that error message on your computers? Yeah, it's saying Epic's down. What do we do in Epic Sound? What's a downtime form? Paper charting? They didn't teach us that in nursing school. You mean we have to write everything down on like paper? I don't have time to paper chart. I am looking for anyone that could verify insulin with me. Okay. I got an email back from the manager about my PTO, so I hope she gave it to me. I was supposed to go to a wedding. What? Request denied? Who took the last wipe and didn't replace it? I mean, like, who does that? Hello, is this pharmacy? Yeah, I'm missing a medication on bed 18. Sure.
All right, Ravi,
Anyone there?
we can cut it short. I want to make sure we get out on time. I hope everyone found that funny because it's so relatable. All of those events happen to us at least once, each of us nurses. So I hope that gave you a little boost, but that's what humor can do for you. It naturally boosts us, boosts that optimism. And Joanne, I just want to, this is so important what she wrote in here. Can you tell them Italian? That I wanted to make sure I talked about this. In response to language matters, I have given permission to a friend to remind me if I am speaking negatively about myself. That's incredible. That really is. And, you know, I'm sure that they catch on and they tell you, and all of a sudden, boom, goes into your mind. And then you're intentional from that moment on to be more optimistic and have more positive self-talk. And you trust that person, right? That's so important. And here at Nurse2Nurse, we can do the same for you, but you can also have a support buddy at work, at home, anywhere. She also watches videos, pets, children, surprises. Aren't those the best? Just take a second, right? All right, so I hope you enjoyed this webinar, just real quick. And by the way, if you ever have any questions about something we discussed, feel free to contact us. Just a simple question. Hey, Babs, can you just send me a little more info on language? I wasn't quite connecting it, or I'd like more tips on it. Whatever it is, we are here for you. We're putting you first so that you realize that you should, need to, and deserve to put yourself first. That's such a huge message that I want to make sure you know. All right, we have 2 more minutes, but I can get through these next slides easily. Our webinars, this is the first 6, which today is the 6th one on optimism. Stay tuned because we have a great, awesome series because we've gotten so much feedback with these last webinars that we've held. So now these new 6 webinar series, the series that's coming up, this is going to be the requests from everybody. or if I may, the nursing needs that have been voiced to us. We hear you, we see you, we are you. And that's what these webinars, what we're trying to do is let you know all of that. Okay, next slide. Nursing heart story. I always give one about the topic. Optimism. I gave you it already with the Post-it notes example that I gave you. And man, was that effective. You could do it for yourself too. It doesn't mean you have to do it for everybody else, just for yourself too, right? Put it on the mirror. First thing you see in the morning, we all look at ourselves, right? We're next to the coffee pot. Okay, here's our resources real quick. We have the live peer support line, online chats, wellness webinars, these virtual groups. We have outreach events. If you contact us, we can come and do a whole presentation about wellness for you. And we also have provider networks. People, we have a spiritual, medical, psychological providers that are just for nurses, which I think are so important for us to know that they exist out there, and we're the place you can come to find those things out for yourself, for your coworkers, wherever the need is. Yeah, thank you so much for, I really, really hope this was a self-care hour for you. I know I did a lot of talking, but I just really hope that you took a moment to feel good. and yeah, we'll see you next month, but give us a call, whatever you need. We're here for you.
All right. Thank you so much, Babs. And thank you for everyone for joining us. Again, we just want to offer our phone number. It's 844-687-7301. Call anytime. It's confidential. A nurse is going to pick up the line. So you have direct peer-to-peer support, someone that understands, that's been through situations similar to yours. And just, it's so much easier when someone knows. Please visit us on our website. And most importantly is when we do offer more webinars, what we're going to invite each of you to do is bring one or two of your colleagues, your coworkers, invite them to Nurse2Nurse, tell them about the webinars, share the information. There's so many nurses out there that are working, that are just in a space where they can utilize some more support. And we've created this small community to make sure that our nurses feel supported. So again, thank you very much. Enjoy the nice weather. We have a few days coming up where it's going to be great, and we'll see everyone next time.
Enjoy your 4th, guys. 4th of July.
All right.
Thanks
Take
for
care.
coming. We're here for you.